Good evening, everyone. Welcome to the Doctors in the House Health Show on 99.1 FM, WUJM, St. Petersburg Community Radio. We have an excellent program for you tonight. Please stay tuned. Good evening, everyone. Welcome to the Doctors in the House, your health show. This is a show about wellness, mental health, and disease prevention. I'm Dr. Morency, your host. Thank you very much for tuning in to 99.1 FM, WUGM, St. Petersburg, Florida. And for those of you online at 99gemstheberg.com, thank you. Please, you can call us at 727-637-2416 for any feedback and comment. Now, our topic today is living your life in balance, mind, body, and soul for optimum health. Our guest today is Dr. Carolle Jean-Murat. She's a returning guest. So, today's show is probably the most powerful, consequential program we've had since the start of Doctors in the House. In fact, last month, we kind of began the series with Dr. Carolle by starting with chronic stress. Dr. Carolle is a board-certified OBGYN, a fellow of the American College of Obstetricians and Gynecologists, and a primary care specialist by training. Now, last time we talked, we didn't do a good service by kind of not pointing out her other skill and talent. For the past few years, she worked as an intuitive health consultant and is a director of the innovative type 2 diabetes remission program. And she's been a healing mentor to medical student, resident, and physician in the U.S., Haiti, Mexico. So we did start the program with talking about chronic stress last time, but we kind of changed course a little bit. So let me take a brief moment to tell you what happened. I've known Dr. Carolle for over a decade, and I read a book, I know her medical credential for sure, I know her bios, her CVs, and again, her multiple books. While I've been aware of her special gift as a healer and intuitive human being, I had no idea to what extent. So when over about 2 months ago now, we discussed the idea of doing a series of shows on dealing with chronic stress and its effect on overall health by using a totally holistic approach. I was very happy and thrilled. And during the show last time, most of you listeners who listened to the show and even heard from the station manager, because of the nature of the show, the feedback was very positive. And after the show, I kind of called her to let her know that the show's been well received and we can do more. She informed me that we could do better, especially for the long term, because we need to use her extraordinary intuitive talent. So, Dr. Carolle, thank you again for coming back to the show and for offering us to reach out and touch our heart, our mind, and your soul, and our soul with this gift. So it's a pleasure to have you.
Thank you for having me. Before we start, I would like to make a slight correction. My type 2 diabetes remission program is not at UCSD. I am a mentor for medical student and residents from UCSD School of Medicine. Okay.
I stand corrected, and you actually had it right. That's fine. Thank you.
Yes.
Well, why don't we go ahead and start and quickly by asking you a few questions, if you don't mind.
Yes. No, I don't.
Now, when we did the first show, as I said, we didn't do a service by not really bringing your gift, your talent to the people. So we're going to make sure we correct that. So one of the few things we did not do is stress enough that during the introduction last month, about your special gift. So, my question to you is, what is that gift? What is the intuitive gift, and where does it come from? And when did you become aware that you've had such a gift?
Intuition is something that we all have. We know. It's just like someone said, don't go there, don't do this, don't date this man, don't eat this food. We have it, but with time, we don't trust ourselves, and we just lose it. That's simply what's happening.
Okay. So why don't you tell us about the journey you've had, this wonderful professional, spiritual journey that you've had, and how you made the transition from practicing in a traditional medical system to you're now currently doing consultative medicine and intuitive medicine.
Would you believe that 50 years ago today I started medical school in Mexico?
Wow, time flies when you're having fun.
Time flies, and I'm still at it, and that's what I have, my gift that I want to share. I'm still at it. Anyway, I come from Haiti. I come from a family of indigenous healers. My paternal grandfather, he was a well-known spiritual healer. People will come from all over the country and stay in his healing temple, where the doctors couldn't do anything for them, and then they told them, you are going to die. I was very ill when I was 9 years old, and then the same thing happened to me. Yeah. And at the time I decided I wanted to become a doctor, and even though I've never seen a female doctor in my life. My mother was a midwife and an herbalist. I helped her when she lives in a small village, and I went to visit her when I was 11 years old, and then I helped her doing hope delivery.
Wow.
And I said, I want to deliver babies, but I had to deal with all that blood. My paternal grandfather had a gift of spontaneous healing, so I grew up hearing that they have those gifts, and then I went to I decided to go to medical school. I ended up, like I said, 50 years ago. After finishing...
So you came to the United States, and then you went to
yes.
Mexico to start, yeah.
Mexico to study medicine in Guadalajara. Mm-hmm. Then I spent 1 year to have excellent training with the University of the West Indies in Jamaica. Mm-hmm. Then I went back to Mexico to do a 1 year as a general practitioner, living in a village, and then delivering babies.
Yeah.
The what?
Social medicine.
Social medicine, yeah, they call it. Yeah, I had to. It's part of the training. Then you can take the finals and have your license. Okay. And then also I'm fluent in Haitian, Creole, French, Spanish, and English, and I can dab in Italian.
Wow.
So, and I practice medicine in different settings, from academia to remote hospitals, in community clinics in Haiti, Mexico, Native American Reservation, and in the U.S. And I've performed surgeries in the most sophisticated hospitals in the U.S., and also I've done surgery in the flashlight in Mexico. So all this have given me a broad spectrum approach to health and healing, because what you can do in a fancy hospital here, like in the hospital in La Jolla, the fancy place in San Diego, is not the same thing you're going to do in Haiti in a small clinic or operating room where sometimes you have a flashlight.
I can understand that. That's very challenging, especially in
that's very challenging. Yeah. So that what it does, especially as a surgeon, so I had to make do of what I had, and also it gives me an opportunity to learn more about people in all walks of life, and use what I have on hand. And so the most important thing is, I was raised, since I was 4 years old, I went to live with my paternal grandmother, Eugenie. She was a very strong spiritual woman, a woman of faith, and she was an herbalist.
Wow.
And so what happened is, the first time I started hearing, I call it the voice in my right ear, we were here in San Diego, and I started my practice 40 years ago. Okay. 40 years ago. Okay. I started my private practice. I'm a tough woman. I said, it doesn't matter if I'm a woman, I'm black. I was the only woman in my hospital, and only black.
Exactly. That's a very good point to mention. Okay.
Yes. I was the night OBGYN in San Diego, and then I was the first black woman OBGYN surgeon, and I stayed the only one for 12 years. Okay. But what is happening is, one day I was on my way home, but I decided to go and get some art supplies because I'm an artist also, and I wanted to paint some things for my office. And as I got out of the freeway and I'm at the stop sign, I heard, "Go home, go home." I said, "What is going on?"
So
I have to make a left turn.
This is the first time. First time.
First time.
Okay, that's interesting.
I heard, "Go home." Then when I came to a stoplight, because I have two more lights to go. On the right, there is the store, this art store. I stop at the red light and I go home. Then by the time I go in the parking lot of the store, and I heard, "Go home." And I said, "Oh my God." It's just like the voice would not let me go to the store. So I make a U-turn, and when I got home, I opened the door. I saw a bunch of blood in the carpet. And I followed the trail. I called Grandma. She had passed out. She was bleeding from an ulcer, and she has passed out, almost no pulse. So I called 911. They came right away, and they took her to the hospital. And they told me if she would have waited like this, within 5 minutes, she would have been dead.
Wow, that's extraordinary.
And then, of course, they took care of her. They had to give her like 2 units of blood and everything. And then, so I forgot about it. I went on to my practice. And imagine, I'm the only woman, only black, only surgeon in that part of the county.
Part of the world, yes.
In that part of the world. And then a Jewish lady, her doctor, a gynecologist, was out of town. Things happen for a reason. And called, and then they say, "You know what? My daughter called from school. She's having some problem." And they say, "Oh, we know there is a very nice female doctor because she was 17. Why don't you go and see her?" And if they call and they say, "I am so and so," and then I'm Dr. So and so's office manager. Mm-hmm. And I said, "Come right away. Then so when I saw her, of course, she was in a situation that required that she needed to be hospitalized and have surgery. Mm-hmm. But I said, "Okay, go to the hospital and have some an ultrasound to confirm my clinical finding." And then and by the time I left, the radiologist called me and said, the test is ready. So I left my office and went there. So while I'm driving, the voice say, "Don't operate. And I'm going, "Oh my God." And I am total science, after this, those are the criteria you operate.
Sure.
And then, so I said, I called the mother. And then she was now in the room, and then she looked comfortable. She's smiling, and then I'm touching her hands. And I said, "How are you doing?" She said, "I'm okay." And I said to the mother, I need to say something. I cannot operate on her." She looked at me because the radiologist, her office where she works is upstairs. Mm-hmm. She already knows she talked to the radiologist. She will have to be operated on. And then I told her, "I can't operate on her, but what about if we wait? What is the hurry? She's in the hospital. If there is any emergency, let's say if she's having a lot of pain, or if the fever, her temperature was 102, very high. Normal is 99 point, less than 99.4. So, and I'm thinking, and I'm saying, I cannot operate on her. We'll see. We have a blood test, a white count, or elevated. So I said to the mothers, it's just I'm being inspired. Tell the mother this, then you'll wait. So I convinced the mother we needed to wait.
What was the response?
The response, she just looked at me, and she just looked at me. But I feel also I have that gift. If I am with somebody and I'm doing something that is good for them, they know it.
Okay.
They also intuit.
So they have this. They have the communication as well.
They have the people. That's what I realized. We all do.
Okay.
But I said to her, and then I said something logical. She's. Why would I go and open her up at 17? And then whatever I do with her as a gynecologist, she might never have any children. When she's smiling, and I ask her, she's okay. The mother said, "Are you okay?" "Yes, I'm okay." So I had to convince the mother.
The parents,
and then, yes, and then she said, and I said, she's not eating. If you're going to have surgery, you have to be in NPO. She's not eating at all. So anytime there's an emergency, they're going to call me. I live not too far from the hospital. I'll come and operate on her. And I call a colleague who assists me. We have everything ready. She ended up going home.
Wow.
But I need to tell you then, at the time, I called my grandmother. I said, Grandma, this is what's happening. And my grandmother told me, you have to listen. Okay. And I said, what's her name? I said, her name is Mary. This is Mary. I'm going to light a candle, and I'm going to pray for the Holy Spirit to guide you, and she will be okay. I didn't believe it, but my grandmother told me, I have to listen. And you know how it is to be in a hospital. They're watching your every step you make.
So you have a backup in your grandma.
That's it. I have a spiritual backup.
Okay.
And then that's how, by listening to that voice, so things start happening. I will have a premature baby or anything, and everybody knows they cannot get pregnant or whatever. They call my mother. Everybody knows my grandmother. I will call my grandmother, and things will be fine. And it is happening. So, and then that's what it continued for years until. Go ahead.
Don't forget what your train of thought, but I wanted to really go back to the voice. Now, when we have intuition, usually it's a hunch. I never hear a message, although I have a presentiment of something that I should do that I'm not doing right. But so, how do you describe that voice? I mean, it's something you hear?
I hear it like you say, go home, go home, go home, go home, go home.
Wow.
Or don't operate, don't operate, don't operate.
And what does it sound? Is it a?
It's a thought wave. It's a thought wave.
Okay.
It's not a sound.
So it's energy. Yes.
It's an energy.
Okay.
And it's energy. It's just like when I see, and if I'm looking at a patient, and then something happened to that patient, I see it with like here in California, we call it our third eye. So I see, I know, I see. But we all do, except we do not. You said no. It's just you could be driving down. I'll give you an example. And then something says, you know what? Why don't you make a left now? We all hear that voice.
Yeah.
Why don't you make a left? Maybe you should make a left. And then you're going to go somewhere, and something said, why don't you wait a minute? Don't go.
Well, a lot of time we are so distracted with so many other noises. It's hard to really, and then you have to. Obviously, if it comes to you as a shock, something you don't anticipate. But most of the time, yes, you're right. People do have hunches. They have those little voice telling them what to do and not to do.
Yes.
But we suppress those stuff. We
suppress it.
We remember the books. We remember the pastor or the preacher or whatever giving us all kind of advice where...
It will come to you. Hear that voice of the pastor and say, remember. And they call it, some people say, my guide, is my angel. But it's there. It's just like, to me... I'm in science surgery, and my grandmother, who's a very strong, I love her. I trust her.
Well, you mentioned also you had the privilege of meeting other mentor other than your grandmother who actually helped you a little bit. Can you just tell us about it?
Because what happened was my grandmother died in 1991. She died in August 10th, 1991. It was the first time we had somebody who died in our family. I felt that my right hand was being cut off. That's how I felt. But then I came back from vacation, and then I'm supposed to, when you're busy OBGYN and I have a surgery on Wednesday. I have 2 surgeries on Wednesday. So my grandmother died on a commode. She always said, the day I cannot take care of myself, I'm going to die. That's it. She got on the commode and she died. She was 87, very healthy.
So
no medications. Yes, that's my grandmother. So then what do you do when a loved one died? At the time, I call my travel agent to say, I want to fly in the next morning. Oh, and I heard her. You're not going anywhere.
Wow.
You're not going anywhere. You're going to speak tomorrow at 1, and then you have the 2 surgeries. The patients have been waiting for you because it's very hard, because to have a surgeon or an assistant is very difficult to put a case where you need two people. It's very difficult. And they say, you're going to do the case, and then and then you can fly Wednesday evening, and then you can have my wake on Thursday, and then you're going to bury me on Friday.
Makes sense.
I go, oh.
Makes sense.
And I call my sister. I say, sis, this is what happened. And they say, oh, Grandma, she's strong enough to talk to you when she's dead.
Well,
I was crying.
She knew the score.
Yes.
Listen.
She knows the score. So that's what I did.
Let me ask you this quick question here. So you had the privilege of having the voice and recognize the voice, but you are practicing among a lot of professional scientists, people who are skeptical. What was the implication of that for you and your practice?
In my practice, it's just like when that lady went home, when that young lady went home, we were in the hospital. When she went home, and then I didn't know everybody was watching me.
Of course, they probably think you're not operating in full deck.
They say I'm a character, but guess what? Pretty soon, my practice was built by my colleague. My colleagues just start sending me their wives, start sending me their daughters, their mothers. I had a doctor, Dr. Metzer. Not too long ago, he was the president of the California Medical Association, and he called me. He called me one day, and he said, "Carolle, my mother was at the time years ago, 65 years old, and said they told her they found something. She was having some pain. This is something, and she said there's nothing wrong with me." And my mother is very stubborn, just like my grandmother.
Yeah.
And I said, she said, the only way I would let my mother not do anything or have surgery is if you tell me.
Yeah.
So what I did, the mother came, and I'm looking at her. She is there with her husband. And then she said, I say, Mrs. Metzer, are you okay? She said, I'm okay. The doctors are finding, I know my body. There's nothing wrong with me. And then, but I said something, and I found out later, I have a gift of healing by touching as well, just like my grandmother had, and my grandfather.
Okay.
So I said, can I examine you and touch you? She said, yes, do whatever you want, because there is nothing wrong with me.
Now, did you pay any emotional toll on this, emotional, physical, and while navigating through this? Because this is exceptional, though.
I suffered mostly financially, especially by the time I could not operate. As a surgeon, you make money by cutting up people.
Yeah.
So when and it's simple. For example, people say, "Oh, this is a great gift." No, when you're bleeding, anything that you have is you're having stress. Your spiritual. You don't have the strong spiritual backbone, and then the stress can come into you, and then you have toxic emotions. That's what makes you sick.
Yeah.
So when a patient comes to me and she's bleeding, so I'm a gynecologist, my money comes from surgery.
I understand.
But then, I didn't tell you, the day I went to speak, I kept the promise and stayed. That day I met Bibi Denise. I met the person who took over my grandmother and started teaching me about the mind-body connection.
Okay.
So then now I'm at a different level.
Yeah. So you're pursuing this to...
I'm pursuing this.
So you can
Yes.
Provide the best care and get to the bottom of what people are suffering and dealing with.
Yes, and my patients will come. I used to ask myself, what are those cancers they're talking about?
Yeah.
Then retrospectively, I realized I was there for my patients. They knew it's isolation and being alone.
Yes.
Because they're going through life, things are happening in their lives, but they said, I can call her because it's so-and-so is bleeding, so-and-so, and I say, feed her in.
Okay. Dr. Carolle,
yes.
Time is an essence. We're here. So what I'm going to do is, let me ask you a question about, you changed the topic today to living your life in balanced mind, body, and soul for optimum health. So what is the importance of having a balanced mind, soul, and body? Is that necessary to have optimal health? I mean,
this is the answer.
This is the answer to get optimal health.
This is the answer. This is the answer.
Okay.
Imagine a house, and the house as a foundation.
Mm-hmm.
Our soul, our spiritual health is that foundation. Is our life and energy source. And this is what happened when you have a strong spiritual background, like my grandmother.
Mm-hmm.
And then you cannot toxic emotion. There is no space when you're full of the spirit.
Okay.
And spiritual health. And then I was thinking after we talked the other day, and then what is it the most important thing? Is having faith and also love. When you have faith, you trust or higher power, depends whatever you question, and you request Jesus and you pray, and you know it's there for you. How can you get sick?
So what's form a solid spiritual foundation? I mean, we have a lot of challenge in our society because it seems like people are moving away from spirituality. With technology increasing development in science, and it sounds like from what you say, this is probably one of the most important thing. So
yes, and our next show, remember, we're going to do a show on that.
Okay.
We're going to have the whole show is going to be on your spiritual health, how to strengthen it, and then how. Yes.
So you said that our spiritual health essentially is one of the most integral part of our overall well-being. It's a life force, the energy that connect us to others and to a higher power.
Yes. And 9 out of 10 of my patients who are sick don't have a good spiritual background. Or even if they have it, something happened, they get angry at God, and then that's where they get sick. As simple as that.
Okay. So, for this. Now, and you also mentioned about, obviously, mental health, to have a mind intact and be able to have some good So the physical body is kind of the last thing. If we don't have our mind, we don't have our spirituality, then
the body,
we're in tough shape. Okay.
It's just like, remember, let's use the metaphor of the house. We have the foundation.
Sure.
And then we have the walls, or the mind, and then the body is the roof. Without the foundation, there is no house, there is no roof.
Okay. So so what you're saying is that all of us should actually really take an inventory of our lives and see where we fit in that scale. Where do we stand in terms of spirituality? Where do we stand emotionally?
Yes.
And finally, physically, because if you don't have the first two, you're probably going to suffer physically.
You will.
Okay.
That's why the disease will be able to come in.
Okay. All right. So what should people actually, the first thing for people to do after they listen to that show, because certainly we're going to talk more about those things in coming shows, and I wanted to basically put the foundation there. So the most important to get out of this is to know that good health means more than a healthy body. It means strong spiritual backbone, healthy mind, and that will lead us to a healthy body. Is that correct?
Yes, Dr. Morency. Yes, Dr. Morency. That's what it is.
I had a sense of that, and I don't have that skill to practice that, but we're gonna have to really finish the show today. But let me tell you, Dr. Carolle, Jean-Murat, I'm really thank you very much for bringing this to us, to our listeners, to everybody, and my listeners, please, I thank you for listening, pay attention. And if you really want to learn more about Dr. Carolle, please visit our website, www.drcarolle.com. You said you were going to spell it, Dr. Carolle?
It's DrCarolle.com. DrCarolle.com, my first name, yes.
Thank you very much, Dr. Carolle. Hopefully
my pleasure.
We'll have that other show ready for the public. And
go ahead.
Yes.
How to strengthen your spiritual foundation for optimum health.
So that's the next show. How to strengthen your spiritual foundation for optimal health. We cannot wait to learn the importance of solid foundation spiritually, and to get the tool that you're going to provide us to deal with
how to do it. Definitely.
Thank you very much.
Thank you for having me.
And thank you, listeners, for listening to the show, for paying attention. We appreciate you. And let me tell you that a copy of this show will eventually get to my YouTube channel, which is YouTube /Dr. Yves Morency. Feel free to make any comment if you listen to those, you watch those videos. Thank you again. Please call if you have any feedback, any question you want to leave for the next time. Call us at 727-637-2416. Thank you very much.
This is Cara Festa Radio. 99 Gems, The Berg.